I'm Dr. Tab Bounds. I'm a clinical psychologist and the Associate Clinical Director for Louisiana's Office for Citizens with Developmental Disabilities. Today, I'd like to talk a little bit about the applicability of cognitive behavioral therapy, or CBT, for individuals with intellectual or developmental disabilities, or IDD, including autism. I'd like to start off with this basic fact. First-line treatments work for most individuals. This is easy to understand when we talk about medical health treatment, but it also applies to mental health treatment too, albeit some personalization will be needed, just like with medical health, where it's the case that not everyone receives the same dose of medication. The physician accounts for age and sometimes even weight. So what I'd like you to know is that the applicability of cognitive behavioral therapy for people with IDD just needs a few modifications to personalize it and make it effective for your individual. Today, we will focus on recovery concepts and the importance of focusing on these in therapy and in preparation for discontinuing therapy. And you may find that some of these modifications would and could be used for your folks without IDD too. For a therapeutic intervention to be deemed successful, the developed skills and the positive outcomes achieved during the active therapy phase need to be maintained after the conclusion of therapy. While symptom relapse does occur for many therapy clients, thinking about and planning for this situation can help lessen the impact of any symptom relapse, which can support resilience and protective factors. This is true for people with IDD as it is for people without. Hope is a key concept to both success during therapy and for resilience after therapy ends. It is essential for the therapist to believe and to convey to the client that people with and without IDD can and do experience recovery. While this may seem to be an obvious statement to a therapist, consider that a person with an IDD may have learned that their IDD condition is permanent and that they will always experience limitations or barriers related to the IDD. This can impact their view of the CBT process in a negative way, leading them to believe that improvement and recovery is not attainable. As therapists, we have to be mindful that we do not make assumptions about the capacity for learning and recovery simply based on the person's IDD diagnosis. Multiple factors can impact resilience. This is true for people with and without IDD, and in general, factors influencing resilience are similar. For each factor, strategies that strengthen the area can result in protecting the person or decreasing the likelihood of experiencing continued mental health symptoms. Protective factors can improve long-term outcomes and act as a buffer to help maintain the skills and techniques developed during therapy. First, poverty and socioeconomic status. How does the person's current economic stability factor into their recovery? Will they have access to needed supports in the community? Will a lack of funds, technology, or limited transportation impact their ability to engage in social activities? Strategies to protect this area may include identification of challenges related to the person's economic stability, housing, or transportation. Identifying other known resources the individual may connect to, and be sure the person's supporters are aware of how generalized worry and stress over things like paying bills, having a clean and safe place to stay, and getting where the person needs to go can impact worry and sadness. Second, limited meaningful activities. Is the person employed, or do they have employment prospects? Are there volunteer opportunities? What other community-based activities will they have access to regularly? Focus on activities that are truly meaningful to the person, such as work or volunteering, to increase the feeling of efficacy and engagement in the community. Strategies to protect this area may include identification of interests that may help with connecting the person to other community members and activities, and identifying opportunities to engage with community organizations, such as religious organizations, volunteer agencies, or clubs. Third, weak support networks. What does their support system look like? Do they have family and friends who are active in their life? Are the majority of the people in their life paid to be there, such as direct support workers? Make improving and solidifying their network of friends and family a priority. Strategies to protect this area may include connecting the person to a peer mentor. A peer mentor is not limited to a person with an IDD. A peer can be anyone with similar life experiences or similar interest. If the person enjoys going to the gym, then a peer mentor could be another person who also enjoys going to the gym and who could provide support and motivation. Look for opportunities in the course of the person's work and daily activities to meet people and foster new relationships. You may need to help those supporting the person understand the importance of making new connections and building relationships, and give them tips on if the person needs help in the area of engaging with others. Provide guidance to supporters on when they may be over-helping and perhaps getting in the way of new friendships or relationships. Fourth, awareness of IDD. Another factor related to long-term resilience and outcome is the person's awareness of their IDD. Does the person feel different from others due to their IDD? Are they aware of discrimination by others? Have they experienced negative interactions with others because of their disability status? Often, people with IDD need to rely on others for assistance for some activities. Unfortunately, this can lead to over-reliance on others or for caregivers to become overprotective. This can lead to devaluing one's ability and erosion of the person's sense of self, autonomy, and agency. Strategies to protect this area may include helping the person identify their strengths and identify how they can use them to work towards their goals. Building and reinforcing the person's coping skills and problem-solving skills is an important aspect of bolstering their sense of self and value. Finding typical roles for the person in the community can also support their sense of self and independence. Develop a plan with the person to seek the needed education and skill development after the conclusion of therapy. Remember to focus on these 4 factors that impact resilience. 1. Poverty or socioeconomic status. 2. Access to or limits in meaningful daily activities. 3. Limited social support networks. And 4. Awareness of being different or having an IDD. While these factors impact those with or without an IDD, individuals with IDD are at greater risk of experiencing these, so it's even more important as a therapist to attend to these issues. These and similar issues should be addressed prior to discontinuing therapy. Developing a plan and skills to address these issues will improve the chances for positive long-term success. The plan must involve those who provide support to the individual, so that they are also aware of the importance of these factors and are committed to implementing any plans to address them post-therapy. Individuals with IDD often rely on others for support throughout most days. When an individual's primary supporters are friends and family, they typically have a larger and more involved support system. In this instance, the challenge will focus on making sure that the relationships do not shift, so they focus mostly on the support needed. It is important for family and friends to still have the time to just be family and friends. Talk about these relationships and provide guidance on any adjustments that may need to occur to support the natural reciprocal parts of these relationships. When an individual has mostly or all paid supporters, it can be hard for these staff to stop and consider the need to focus on helping the person develop natural and community connections. Building these other relationships helps with both sense of self due to being valued by others and security because our natural relationships and connections are more durable and lasting. Successful therapy results in generalization of the skills developed during the process, and those skills are maintained over time. For a person with IDD, specific attention should be paid to these 5 areas that should be addressed in therapy activities. First, therapists can leverage the assistance of caregivers in the person's life. Anytime a caregiver is brought into the therapeutic process, it should be approached from the perspective of informed consent and choice on the part of the client. For many people with IDD, they are comfortable, or at least accustomed to, assistance from caregivers. For example, caregivers can assist the client in identifying when symptoms are increasing in severity or frequency. Caregivers can encourage pro-social behaviors, engagement in wellness activities, and provide reminders about utilizing effective skills, strategies, and techniques developed during therapy. For caregivers to engage in this effectively, they will require direction and education from the therapist. Second, one method to train, educate, and prepare caregivers to assist with maintenance after therapy is to engage them in the therapy process prior to discharge from therapy. Asking the caregiver to review homework assignments when appropriate and with the consent of the client can assist them in knowing the expectations and what is working for the client. They can then ensure that these positive habits continue post-therapy. Also, caregivers can be educated on signs and symptoms that would warrant a return to therapy. Third, when discharging a person from therapy, fade the process where sessions become less frequent over time. Build booster sessions into the process when possible. For example, after completely fading the therapy sessions, schedule a booster session for the future, 3 months or 6 months or longer, depending on the specific circumstances. Fourth, ensure that the person has a crisis plan. What should they do and who should they contact in a crisis situation? Is there an identified coping skill they should engage and a specific person they should reach out to? The person's caregivers should also be aware of this crisis plan and assist the person in implementing the plan. And finally, here are 5 factors related to general wellness approaches, which are as relevant to people with IDD as they are to other groups. 1. Exercise. Exercise does not have to be limited to the use of a gym or even exercise equipment. Walks in the neighborhood, volunteering, or a job as a dog walker, raking leaves, or dancing are all examples of exercise that can improve the person's outlook. 2. Healthy eating. Most people have a balance between healthy eating and not so healthy eating. A balance between preferred healthy foods and less healthy options that is based on the person's choice is an effective method to ensure a reasonable diet. Third, spirituality. Although spirituality is often expressed through religion, it can be any activity that recharges the person and helps them connect with the world. Spirituality may be accessed through attending worship services, camping near a river, singing or listening to music, engaging in art or other activities that engender a sense of peace, appreciation, inspiration, or gratitude. 4. Rest. Stress can be the downfall of a person's mental status. Scheduling rest and relaxation can thwart and reduce the impact of daily life stress. Rest could be combined with spirituality as they can go hand in hand in facilitating a sense of peace. Encourage the client to identify restful and relaxing activities that can help clear their mind of stress. And 5, creativity. People express creativity in multiple ways. and it does not have to be limited to what is traditionally defined as art. Creativity can be expressed in your work, in problem solving, in planning for events. The opportunities are myriad. Assist the client in realizing where these opportunities are and how to engage in them. Remember these 5 key strategies to address resilience and protective factors. 1. Leverage the assistance of supporters or caregivers. 2. Use in-session training to provide supporters with the knowledge they need. 3. Fade therapy slowly. 4. Help the person develop a plan to avoid crises. And 5. Talk about and provide tips on general wellness supports and activities. Focusing on resilience and protective factors can have a significant positive impact on recovery. This is especially true for people with IDD who may have a history of reliance on others, a belief that they are not effective, and limited agency in their own lives. People with IDD experience behavioral health issues at rates higher than the general population. They benefit from the same evidence-based therapeutic interventions such as CBT and DBT, which are used for people without IDD. The provision of CBT for people with IDD is not related to a niche area that requires years of specialized training. Rather, it's a cultural competency on the part of the therapist that typically requires only common sense modifications, which do not impact the core values of the intervention. Today, we talked about recovery-related factors that require planning during therapy so that the therapy gains can be sustained when the therapy ends. There are other modules in this series that may also be helpful for you to view. Thank you for taking the time to listen to this brief presentation.